Good morning or afternoon, everyone. Thank you very much for joining us today for the webinar, Focusing on What Matters, Engaging Stakeholders in Developing Evaluation Questions. I'm Hallie Preskill, Executive Director of FSG's Strategic Learning and Evaluation Center. Here at FSG, I have the privilege of working with a wonderful staff and many different kinds of organizations to help design and conduct strategic evaluations and systems that inform decision-making and action, with the goal of achieving social impact. I spent more than 25 years in the evaluation field, and if I've learned one thing, is that for evaluations to be useful and used, it is important to design them around questions that are critical to understanding the effects and impacts of whatever we evaluate, be they programs, processes, products, policies, initiatives, or organizations. It is generally acknowledged that when evaluation works well, it provides information to a wide range of audiences that can be used to develop greater appreciation and understanding, and to make better programmatic and strategic decisions. One way to ensure the relevance and usefulness of an evaluation is to develop a set of key questions that reflect the perspectives, experiences, and insights of as many relevant individuals, groups, organizations, and communities as possible. As we will emphasize in today's webinar, stakeholders' input is essential to establishing the focus and direction of an evaluation. Taking differing views into account not only creates an evaluation process, an eventual set of findings that will be regarded as relevant, credible, and useful, but the recommendations that result from an evaluation in which stakeholders have been involved may be more acceptable by a broader constituency and implemented more fully and with less resistance. Next slide. As you can see on our agenda today, in addition to me, you will hear from Laura Levitin, Senior Advisor for Evaluation at the Robert Wood Johnson Foundation in Princeton, New Jersey; Robin Lynn Miller, Professor in the Department of Psychology at Michigan State University; Dennis Scanlon, Professor of Health Policy and Administration at the Pennsylvania State University; and David M. Chavez, Principal Associate and CEO of Community Science in Baltimore, Maryland. Each panelist will share their thoughts and experiences for about 10 minutes. Throughout, please feel free to ask questions using the question box on your screen. We will be collecting and sorting through these so that at the end of the panelist presentations, we may ask them some of your questions. We'd like to start off by inviting Laura Levitin, Senior Advisor for Evaluation at the Robert Wood Johnson Foundation, to say a few words. By way of background, Dr. Levitin has worked at the Foundation since 1999, has been involved in more than 80 evaluations. She was formerly a professor at 2 schools of public health, and in 1993, she received an award from the American Psychological Association for distinguished contributions to psychology in the public interest. Dr. Levitin was president of the American Evaluation Association in the year 2000 and has co-authored 2 evaluation-related books. Laura?
Okay, and you might want to change there I am, and there's my face. I'm delighted, everyone, at the attention that this webinar is receiving. I was so pleased that Robert Wood Johnson Foundation could commission Hallie Preskill and her colleagues to create this practical guide for engaging stakeholders in evaluation questions. Because like Hallie, my feeling is that the only justification for evaluation really is that it be useful. And to be useful, we have to know who the potential users are and what they want to know. And certainly for a foundation, this is imperative. So the stakeholder engagement, though, in our field is sort of like the weather. Everybody talks about it, but only rarely do they actually do anything about it. And I think Hallie has been very successful with this practical guide to figuring out some really good strategies for making that practical and doable. I'm also delighted at the commentators and colleagues she's assembled for this project. Both Dennis Scanlon and David Chavez have conducted evaluations for the Foundation, and I have known Robin Miller and admired her work just for years and years. Now Hallie will give you an overview of the process of developing the evaluation questions by engaging stakeholders. And thanks for your attention. Hallie?
Thanks, Laura. Next slide, please. So what I'd like to do is just provide a brief overview of the 5-step process and strategies for engaging stakeholders in developing evaluation questions. What we have here on this graphic, on this slide, illustrates the phases most evaluations go through. As you can see, an evaluation's key questions are typically chosen once a theory of change and logic model or outcome map has been developed. In the focusing phase of an evaluation, the purpose of the evaluation is determined, relevant stakeholders and their information needs are identified, and the evaluation questions are developed. What makes a good evaluation question, you might ask? Well, good questions establish the boundary and scope of an evaluation, and they communicate to others what the evaluation will and will not address. They are the broad, overarching questions that the evaluation will seek to answer, and specifically they are not survey or interview questions. They're much broader and inclusive. They are aligned with clearly articulated goals and objectives, and ideally aligned with the strategy being evaluated, and that they can be answered through data collection and analysis. Evaluation questions are critically important to an evaluation because, as Yogi Berra once said, if you don't know where you're going, you might end up someplace else. Next slide, please. For an evaluation to be useful and used by a wide range of individuals, groups, and organizations, it is important to consider the range of stakeholders that might be interested in the evaluation process as well as the findings. While the list of stakeholders on this slide is not exhaustive by any means, it is important to think about both internal and external stakeholders, especially when developing an evaluation's guiding questions. Next slide, please. Though involving stakeholders in developing evaluation questions can be time-consuming and challenging, there is no doubt it is challenging, but there are several good reasons to make the effort. First, by engaging stakeholders in developing questions, it increases the ultimate quality of the evaluation because it illuminates perspectives you might not see on your own. It can help identify gaps or inconsistencies in the evaluation team's knowledge. It also helps be transparent, and that is a goal increasingly of many organizations as they try to connect with and communicate with other audiences. So engaging stakeholders in developing evaluation questions communicates to others an openness to the ideas, concerns, objections, issues, all of which can help design evaluation questions that produce credible findings. Engaging stakeholders also facilitates the evaluation process. It provides opportunities for stakeholders to vet the questions and to really be sure that the right questions are being asked and answered through the evaluation. It also helps within the political context or with politics in the organization and community because it communicates, or engaging stakeholders communicates a commitment to be inclusive, outward-looking, and expansive. Engaging stakeholders in developing the questions might also help navigate challenging political waters that are part and parcel of every single evaluation. Engaging stakeholders also builds their evaluation capacity just by the sheer reason that they are involved. It helps them learn about what constitutes good evaluation practice as they contribute their ideas to the questions. And finally, it helps them develop relationships and to be collaborative with others. It helps facilitate an opportunity for stakeholders to build networks, learn from each other when they come together, and when they come together to provide input into the evaluation question development. Lots of good reasons for engaging stakeholders. Next slide, please. So when you think about which stakeholders you want to include, there are several criteria or characteristics to consider. You might want to ask yourself a variety of questions as you think about each of these characteristics. So for example, with diverse perspectives, to think about who are the stakeholders that we want to engage who have these diverse perspectives. Who has or needs, has needs or perspectives most different from those in your organization? Whose voices need to be heard? Whose voices are underrepresented or are missing? Who are the critics of the program or initiative being evaluated? You might also want to consider who has expertise in the field or content area of the program that you're evaluating. Who is well respected for his or her knowledge or understanding about this program or initiative. Also consider what the responsibility is. Who manages the program or initiative? Who provides funding for the program or initiative? And to what extent should they be engaged in helping develop the evaluation questions? Also, think about who has influence. To whom do people look for information on this kind of program or initiative? Who are the power brokers within the community or organization? Who are the policymakers working on this issue? Also, you might want to consider stakeholders who really can help build buy-in and support of the whole evaluation. Not necessarily the positive outcomes of an evaluation, but actually the evaluation process. So who can spread positive messages about the value of the evaluation? Who can encourage others to support and participate in the evaluation? And finally, who just has interest and cares about the program or initiative and the evaluation that's being conducted of that program? So you might ask yourself, who are advocates of this program or initiative? Who has been working on this issue from either a research or practice perspective? creative ideas for the future. Our hypothesis, as you can see on this slide, is that if stakeholders can inform the development of good evaluation questions and the evaluation is designed appropriately and implemented effectively, then an evaluation is more likely to produce relevant, credible, and useful findings that can be acted upon with confidence. Next, I will briefly describe the 5-step process for engaging stakeholders in the question development process, as well as the various strategies you can use to engage them. Next slide, please. So the first step is to prepare for stakeholder engagement. And this includes collecting information about the program or initiative being evaluated, its history, why it came into being, who cares about it, what it is trying to accomplish, and what success would actually look like. The next step, next slide please, involves identifying all the potential stakeholders whom you might engage in the evaluation question development process using the criteria presented on the earlier slide. Step 3, next slide, helps determine, you want to prioritize the list of stakeholders and to help figure out which are most vital to the development process, since it would be unrealistic to expect that you'd be able to include all possible stakeholders. Step 4, consider potential stakeholders' motivations for participating. This step has you consider stakeholders' motivations for participating in the development process. So, for example, such motivations might include their commitment to the program or initiative's goals, their personal stake in the program, the fact that they might see it as a professional development opportunity, or as a means for earning additional income if an honorarium is offered. Knowing stakeholders' motivations will help you select an engagement strategy, which is the 5th step in the process. Next slide, please. When it comes to choosing how to engage stakeholders in developing the evaluation questions, there are several things to consider, as noted in the left-hand column on this chart. So, for example, you might say to yourself, well, gee, we really have a short evaluation timeline, so how am I going to engage stakeholders if we just don't have much time? Or you might say we have a limited budget, so we don't have any honoraria to pay people. Or you might say our stakeholders are very much geographically dispersed, and so they're not all in one place. Or you might say there's a variety of opinions and nobody agrees on anything. Or there might not be existing relationships. Stakeholders have very limited time to devote to this effort. There may be many stakeholders. You might have stakeholders that are not familiar with evaluation. And the program or initiative that you're evaluating could be extremely complex. So these are some of the considerations to take into account when you are selecting an engagement strategy. With these considerations, you can choose the technique for engaging stakeholders. Your choice may be based on whether you want to or can involve stakeholders as a group, in person or virtually, or if you want them to participate as individuals, in person or virtually, or if you prefer to engage them via a survey. For example, if you wanted to involve stakeholders who didn't know each other well, they had few existing relationships, then you might want to invite them to a group meeting or to meet one-on-one in person. Alternatively, if you wanted to engage a large number of stakeholders, perhaps more than 100, then you might want to use a survey to develop and prioritize the evaluation questions. Next slide, please. Once you know whether you want to involve stakeholders in person or virtually, and whether in a group, one-on-one, or via survey, you can then select an engagement technique. As you can see on this slide, there are several from which to choose. For example, if you were able to convene a group of stakeholders in person, you might have them participate in a role play to illuminate the various perspectives and information needs of different stakeholders. This experience would help develop a set of evaluation questions that would be inclusive of a broad set of interests. On the other hand, if you want to connect with stakeholders virtually, then you might choose a survey or conduct a moderated discussion via a conference call. So there's my overview. We hope that this has stimulated some new ways of thinking about engaging stakeholders and developing evaluation questions. Now we have the wonderful opportunity to hear from 3 evaluators who have used these approaches and others to engage stakeholders in the focusing phase of an evaluation. The first panelist is Robin Lynn Miller. Robin has 25 years of experience evaluating HIV. Next slide, thank you. Has 25 years of experience evaluating HIV prevention and care programs in community-based environments. Prior to assuming an academic career, Robin directed program evaluation services at the Gay Men's Health Crisis Center in New York City. Since moving to an academic position, her work has involved researching the rejection and use of evidence in small AIDS organizations and evaluating HIV prevention and care programs, especially those targeting Black, gay, and bisexual youth. She is currently evaluating the health impact of community reentry services for HIV-infected ex-offenders. Robin?
Thank you, Hallie. I'm delighted to be here today. Next slide, please. The project that I'd like to talk about is an example of how I've engaged stakeholders in my work was a needs assessment that was commissioned by the Michigan Department of Community Health and its AIDS Planning Council. And the purpose of this was important for the state. The state had underinvested in prevention programs historically, and this was the first occasion where they decided that they wanted to conduct needs assessment activities focused on the highest risk populations in the state. And in my case, that was 13 to 24-year-old Black, gay, and bisexual men. 48% of the newly infected teenagers in the state of Michigan are from this target population, despite the fact that of all teenagers in the United States, they are a very small part of the teenage population. It's a very high-risk group about whom the state knew very little. The needs assessment had to be conducted very rapidly in a year from start to finish. And the one thing that the state mandated besides the need to have qualitative data be part of the needs assessment was that there was some kind of community participation. Next slide, please. We decided to take two distinct approaches to engaging stakeholders in this particular evaluation in order to determine the focus of the needs assessment. The first thing that we did was to look at the epidemiology of the epidemic in the state and identify all of the places in the state where there were concentrations of infection among young Black males. We used that epidemiology then to focus on a set of counties that we would use as the basis for gathering information from adult stakeholders about what it was that this needs assessment should seek to try to learn. We use the Michigan's HIV/AIDS Planning Council, which is a body that is mandated by the CDC for states to create, that advises the state on how it will spend its resources devoted to HIV and AIDS, both care and prevention. And the CDC mandates that that council be composed of people who are HIV infected, people who represent a diverse array of service providers, people from public health institutions around the state and state-level public health officials. So it provides a very nice way to think about some of the different potential stakeholder groups for us. So we use that council as our guide to thinking about some of the different stakeholder groups. We looked geographically then within each of these counties and identified adult stakeholders who were diverse in terms of the role that they played in relationship to the epidemic, that is, whether they were living with HIV themselves and were a local advocate in their county for people living with HIV or for issues around prevention. We looked at whether or not they were a line service worker in a community-based organization, an executive director, someone working in a public health clinic doing HIV testing, and so on. And we identified 21 people, each of whom we then interviewed face-to-face, and we asked them, what is it that they most wanted to know about this target population, why they wanted to know that thing, and how they would use that information if we were able to provide it to them. We then reviewed the national literature on this target population, and we took both the information we had gained from this diversity of stakeholders and the picture that emerges from the national literature on HIV for this target population. And we created a body of 6 young gay men from the target population who also represented the same geographic diversity. We had 6 young men, 1 from each of the high-risk counties and 2 from the Detroit metropolitan area where 60% of the infections are located in the state. And we brought those young men together as a team of co-investigators for the entire needs assessment project. we presented to them what we had heard from the adult stakeholder group and what was known in the national literature. And we had a 4-hour meeting where we hashed through together our reactions to both what the adults wanted to know and also to what the national literature tended to suggest. One of the things that was very striking about that meeting is that one of the young men's very first reaction following our laying out for him some of the topics that the adults thought was important was that all of the things that they had listed were from his point of view, about the providers and not about the target population. He said, it's about us, not about them. And it should be about us. So these young men worked over that 4-hour period to really figure out from their point of view what were the things that were most relevant to other young men that they knew in their local communities that we ought to be learning about if we really wanted to inform the state about how best to think about what kinds of prevention activities ought to be going on, what kinds of things they should be looking to try to fund, and the like. So the young men actually developed a list of priorities. They did use the information from the adult stakeholders to do this, but they also established priorities based on what their sense was of what young men like them would want adults to understand about them as young men. One of the things that I would say about why we took 2 different approaches with these stakeholder groups is that most of the adult stakeholders that we spoke with were straight and white. So we really wanted to make sure that we had a group of beneficiaries as part of this process because of the differences between the adult stakeholders who were going to make policy and program decisions and the target population in terms of culture, in terms of age, and so on. So we thought that was critically important. The other thing, though, was that despite all the pressures of budget and time that we faced, that the younger folks we thought would engage more effectively if we had them face-to-face working with us, working together as a team, and if we tried to do everything that we could do to reduce adult-youth power differentials. So hence, we decided the face-to-face approach with them was much more likely to be effective than using a virtual approach. And I think that our experience suggested that that was an important decision and one that really affected our work together in a positive way. I should also note that these young men did everything. They worked with us on all of the data analysis. They selected and trained the interviewers that went out into the communities. They designed the recruitment strategies with us, and they disseminated all of the results around the state with us. So they were really part of everything. We did actually invest in our budgeting and planning for their participation. So, for example, I budgeted for drivers to be able to drive across the state to bring young men to the meetings and back. I also invested in making sure that we had a formal meal together, including the drivers, at every meeting as a way to begin the meeting. I scheduled things when it made sense for the young men's lives and not for my own. And we engaged in a lot of effort to coach young men to be effective participants in this process, and we maintained active communication with them via telephone and email in between all of our meetings. We also did pay them an honorarium for their time. These young men were very diverse. Some of them lacked literacy skills. Some were living with HIV. Some came from very poor backgrounds. So thinking about those kinds of things and the ways to facilitate their engagement and their comfort with us was very, very important. With that, I will turn it back to Hallie to introduce the next speaker.
Thank you, Robin. Wonderful. Well, now I'd like to introduce Dennis Scanlon. Dennis is Professor of Health Policy Administration at Pennsylvania State University. Dr. Scanlon has led a federally funded research project examining the state of quality improvement activities at managed care plans, as well as projects examining the impact and cost effectiveness of diabetes and disease management programs in federally qualified health centers. He is currently the principal investigator for the evaluation of the Robert Wood Johnson Foundation's Aligning Forces for Quality initiative and the evaluation of the Commonwealth Fund's Evaluating the State of Action to Avoid Rehospitalizations initiative. Dennis?
Thank you, Hallie. I'm very happy to be participating in this webinar, and I'm very glad that the attention is being given to really the practical aspects of evaluation. So I'm happy to participate. What I'd like to talk about today is engaging stakeholders in the context of logic modeling, and as you may remember, logic modeling was presented earlier by Hallie as one of the components of the evaluation process, one of these stakeholder engagement techniques. And I found in the work that I do logic modeling to be both highly beneficial to a variety of stakeholders and really the portion of the evaluation that really can involve some very productive engagement and interaction with stakeholders. Logic modeling is a term that some people use. Other terms used are theory of change. Some may call it a simplified illustration of the expected impact of the program. Regardless of what you call it, I think it's important because programs or interventions are typically multifaceted and complex and quite frankly new. If we really knew how to solve problems or we knew what the answers were, we wouldn't be developing programs. And so as such, there's a degree of uncertainty going into a program on the ground. And I think logic modeling really can help in this regard. Oftentimes there's a broad vision, but not necessarily a clear set of strategies about how to achieve that vision. Logic modeling is useful to multiple stakeholders, certainly the funder, to help them further develop the theory of change, and as I'll talk about in a moment, to get feedback from stakeholders about the proposed theory of change. It's, as I said earlier, very valuable in my experience to grantees or interventionalists or those in the communities that are actually doing the work with the funding from the sponsor. Also highly valuable to technical assistance providers helping those in communities do the work of the program. In a nutshell, logic modeling can help to be concrete about program goals, expectations, assumptions, and desired outcomes, and most importantly, the mechanism of change or the hypothesized mechanism of change for achieving those outcomes. Certainly, logic modeling is also beneficial to researchers and evaluators, and while I won't spend much time talking about that today, the reason I think that's important is because it can help seek stakeholder input so that researchers and evaluators develop evaluation questions, data sources, and ultimately products that will benefit those who really need information, policymakers, community service providers, and others. So with that, I'd like to switch to the next slide and go through an example of one evaluation that I've been involved in. And talk a little bit about the logic model at two levels for that evaluation. This project was an evaluation or a project funded by the Center for Healthcare Strategies, which is a healthcare and health services-based organization primarily focused on Medicaid populations, designed to improve the care for Medicaid populations and ultimately improve the quality of care in Medicaid, as well as the value and cost of that care. The Regional Quality Improvement Project was a program that CHCS initiated, again, trying to ultimately improve the quality of care for Medicaid populations. And this really resulted from national evidence, not only in Medicaid, but in the population at large, about poor quality and poor safety and opportunities to improve in that regard. The program itself was a program that involved 3 different communities. 2 of the communities were states, and 1 of the communities was an urban area and a city. The multi-stakeholder effort was really designed to use the leverage and influence of Medicaid, which often is ignored in many healthcare discussions, or at least not given the same level of attention as commercial health insurance payers or the federal government through the Medicaid program, and to really understand how Medicaid could be involved in many quality improvement activities and use its leverage and its purchasing power to help drive improvement. So that was the specific focus of this program. What I have in this slide in front of you is and I wanted to make the point that there really were 2 levels of logic modeling in this program, and both levels were important for involving stakeholder engagement. This logic model was really the logic model as envisioned by the funder. And while I won't go into the details of everything in the graphic that is presented here, the theory of change was basically that there would be a lead agency, in this case a Medicaid program or related organization, that would establish a multi-stakeholder partnership and ultimately try to develop a vision for improvements in quality of care within the community. As you can see in sort of the center green box of this graphic, there were a variety of broad-based quality improvement strategies that were envisioned to be a part of this program. And while these are broad-based, under each of these, there were many specific options. At the end of the day, it was envisioned that if this program were to work, it needed to affect where care is delivered and the interaction between patients and their care provider teams, be they doctors, nurses, or other healthcare providers. What was important about this in terms of engaging stakeholders is that, first of all, we helped the funder put some concreteness on their theory of change and on their vision, and ultimately to develop what admittedly is somewhat of a simplistic graph. In terms of engaging stakeholders, it's highly valuable because oftentimes by having a logic model in this regard, evaluators can go back and seek input on that overall program model and then provide feedback to the funder about how that's being received or whether or not that's accepted by grantees and by the sites on the ground doing the work. So one level, I guess, of logic modeling is taking the funder or the program sponsor's theory of change, putting it into a relatively simplistic but somewhat concrete form, going out and seeking feedback from the stakeholders in the community who will be doing the work, and then ultimately resulting in modification. So let me go to the next slide. You could switch slides, please. Another level of logic modeling is then to get more specific in each of the programmatic communities. In this case, I'm showing a logic model that we developed with one of the grantees, which was in Rochester. Now, the work in Rochester was ultimately designed, as was in the other communities, to improve the quality of care, but they had very specific approach to how they were doing this. Again, I won't go into the details of the logic model here, but if you have time to compare the slides, you'll see that basically the logic model in this regard is nested within the categories outlined by the program logic model. In Rochester, their goal was to improve diabetes care, specifically for federally qualified health centers and Medicaid populations. They tried to impact clinical practice. They tried to impact policy and payment related to Medicaid and federally qualified health centers. They tried to influence patient engagement and also social service providers who collectively would improve quality of care. One of the things that we found highly valuable and necessary as evaluators is to understand how the local level activities relate to the program activities. And in this case, by working with the stakeholders in Rochester to help them develop their own theory of change or to specify this in a simple graphic, they were highly appreciative, and it helped us as researchers as well to really understand what they were doing so that we could develop evaluation questions that were meaningful and data sources that would answer those questions and ultimately connect the multiple varying programs in the three communities. So let me go to the next slide, if I could. So a few takeaways that I've encountered having done a number of evaluations and worked on logic modeling with stakeholders at both of these levels. I think it's important at the outset to work with the funder before approaching stakeholders to motivate the purpose, importance, and participation requirements in the evaluation. Oftentimes, those in the communities may not understand the evaluation or its purpose, or frankly understand that evaluators can be helpful. And I find that if working with a funder to set those expectations up front, that can be highly beneficial. For researchers and evaluators, it's important not to just take, but to try to give, to provide tangible benefit to the external stakeholders so that the evaluation can provide either, and to do that at once or at multiple points. Logic modeling requires an interactive back and forth process, and it's important to build that into the evaluation process. This can be done by phone, this can be done in person. Ultimately, I think it needs to be iterative, and I think it needs to be an engaging process. I think it's important to have a solid understanding and agreement on the logic model up front, and that really benefits everyone, the program sponsor, certainly those in the communities and their technical assistance providers, and also the researcher. And this is really a note for researchers or evaluators that I think is important to respect the time of external stakeholders and remember that their main purpose is not evaluation, But by the same token, the results of what they're doing on the ground really represent learning that's important to provide for all communities. So I think with that, I'll turn it back to Hallie, and we can move to the next speaker.
Great. Thanks so much, Dennis. Then our third and final speaker today is David M. Chavez. David is a Principal Associate and CEO of Community Science and specializes in the development, implementation, and evaluation of comprehensive community and other large systems change initiatives. He has received the Distinguished Career Award from the American Psychological Association and the Outstanding Evaluation Award from the American Evaluation Association. He has conducted national and local evaluations and has authored several articles on community and systems change, collaboration, community capacity building, and sense of community. David?
Thank you, Hallie, and thank you, Laura, for this opportunity, and thank you, everybody, for their time. I'm going to talk about the engaging stakeholders and asking questions in context of community change initiatives. Community change initiatives provide unique challenges because they involve highly diverse stakeholders, that there's great diversity in the range of power, as well as cultural diversity, and that there's also great complexity and great confusion over what they are. In many ways, they're always learning processes and learning evaluations because of these types of work. The example that I'm going to talk about is an evaluation of a community change initiative sponsored by a national funder to a local community foundation. I need to keep the names secret and confidential because this is a recently completed evaluation and controversial in its findings. The evaluation was for the prior 3 years as they entered their final year of funding in order for the national foundation to learn about what they could for the future grant making and for the local grantee be able to prioritize and learn what they need to be doing in their final year in order to maximize the impact that they were happening. The first, if you can move to the next slide. I wanted just to point out before I begin some things that are important from my perspective in the work that we do. First of all, it's about that engaging stakeholders is about building trust. It's about building relationships. The second thing is about addressing power dynamics and differences, but you have to be aware of that is a major factor. If it's not on the table, it's always in the background. And then thirdly, understanding the stage of initiative development. These initiatives start and have several phases, and there's time to mobilization and beginning to structuring, and later they become more sophisticated and build out so that the questions really have to be developmentally based. But they have to also be focused on learning and usefulness. As I said before, these are new things for all, both the funders and for the local participants, and therefore no one comes fully prepared. And therefore, finally, it's important to build also the capacity for the evaluation, that evaluating these types of initiatives is very challenging, and very few evaluators and participants have been through this before. And lastly, it's important for everybody to be on the same page, that everyone comes to these initiatives with different views of what should be done, different priorities. The funder has what they had initially intended to fund, and therefore, but the local community has their interest, what they put in the proposals, what's happened since the funding had happened, so that these are important factors to keep in the backdrop. Next slide, please. I'm going to explain the story now, and these are some of the questions and thoughts that go through my mind as we go through the different stages that Hallie presented earlier. In starting this evaluation, we knew that it was a sensitive project, that it was highly visible, and that the first method we used was being able to have individual interviews with both the funder and the key local participants. In this case, it was the evaluator, the local leaders of the Community Foundation, members of their steering committee, the local evaluator, and an intermediary organization that was providing technical assistance. We met with them individually to find out what had happened so far, their perceptions and expectations for the evaluation, their past experience with evaluation, because this often frames how people approach evaluation, and very often they've had a bad experience. They're frightened of the term logic model, And this is something that we initially have to work through. And we start on an individual basis because these are very sensitive issues. We have to build relationships, and people feel more comfortable talking about them one-to-one on a group, especially when they have skepticism about what's going on. We also talked about them initially about the barriers and challenges. We found that their management, even though this had been considered a model program, that their management committee had not been meeting for over 2 years, that there was a lack of activity on the ground, and that there were great disparities in the view of what the goals were. We also had to clarify our role, which was that we weren't evaluating the grant, that we were here for learning, and that's easier said, but it takes time to be able for people to believe that that's what you're really trying to do and not trying to determine whether they're going to get future funding. One of the things that we found in this stage as we began to work is that we learned that residents, particularly of ethnic and racially different groups that were targeted to be part of this initiative, were not really included both in the planning or were really aware of the evaluation. So we then had, and as well as that the critics, that we were basically being asked to speak to the choir and people who were strong advocates of it, but that we weren't getting the voices of some of the critics and people who had concerns in the community, as well as I said, ethnic and racial leaders that also had a stake in this project, since it was their communities that were the target. So we conducted interviews with these individual interviews with these people as well, and also as part of it, because they weren't familiar with the with evaluation, we often had to provide them with an orientation about evaluation, the purposes of evaluation, on an individual basis, and provided them some tip sheets about evaluation, so they had some orientation to the evaluation and evaluation process as we were going to practice it. This put them on more of an equal footing with some of the others that were participating. In other projects, we've actually conducted workshops and discussions around evaluation, preparing community leaders to participate with other stakeholders on developing evaluation questions so that they are fully prepared and understand everything before they walk into the room. As part of the process, we identified 3 major issues, as some of which I mentioned earlier, that were facing this organization before we could really sit down and deal with the questions. The first of them was the management of that, why they weren't meeting, what some of the management problems, how to engage the community, and the differing view among funders and grantees, as well as those in the local community, about exactly what were the goals of the initiative. The foundation and some members of the community had felt that the purpose of the grant was to actually make changes in that community, while the local grantee and some of its staff believed that the purpose was to actually create only the climate of change. Now, this is 3 years into a program, and you're evaluating a lot of this retrospectively, so this is also a barrier that needed to be addressed very earlier on, is to get everyone onto the same page. So we could not proceed with the evaluation or even with the evaluation questions until we dealt with these issues, especially what were the goals, were clarified, and there had to be some agreement. Essentially, everyone had to be on the same page. We set up 3 learning sessions. These sessions were really organizational development interventions. They dealt with role-playing, conflict transformation, and really also how to bring hard issues onto the table and preparing people to address them at the meetings with before and after one-on-one meetings as well. We also had to develop a plan for addressing these issues, again, before we could take on the primary task, which was to design the evaluation. As one of these sessions was held where we engaged both the stakeholders, again, the foundation, the National Foundation Program Officer, the local community foundation staff, the intermediary staff, and key members of the local community, now including local residents, leaders in it as well. And that was key in this process was to get everyone on the same page. So we had to first start with developing a common language, defining all these terms. Again, like Dennis said, logic modeling. What does engagement mean? When we talk about evaluation and learning, what do those things mean? So all the different terms, and we really had to develop literally a glossary of terms. The second thing we did was then be able to develop a logic model. We presented the logic model, both the logic model they had put in their proposal, and then we also prepared a logic model based on what we had heard from them and reading their materials and reviewing their activities, for them to be able to review and see the comparison between what they said they were going to do and what everybody thought they were doing. We then spent time working with them to discuss and trying to resolve differences and coming up with really alternatives where there was almost in certain ways two sets of outcomes depending on whether or not it was expected to be setting the climate, but also that would lead to particular actions, and that we were able to capture that. Once we were able to get the logic model and agreement and dealt with some of the historical problems, so it wasn't just a technical challenge, but we had to deal with some of these differences in opinions had to do with long-term community issues, dealing with race relations and other sensitive areas. Because we had done our homework beforehand, and I emphasized the importance of doing your homework in advance about issues in the community, we're really better prepared to understand both how that affects the evaluation, but also to help work with the groups to be able to resolve some of those differences enough to be able to have a discussion about the logic model. Finally, what we were doing was being able to get to the point once the logic model was completed, we basically were then able to ask the questions, and we were able to facilitate that discussion by asking three questions. The first question was, what do they need to know for implementation in the last year? Again, focusing on what their needs were on both from the foundation, intermediary technical assistance organization, the community representatives that were there, as well as the community foundation grantee. The second facilitated question was, what do they need? What information do they need to demonstrate their success as both client, as setting the climate, as well as taking action? And the third question that was used to facilitate what their questions were is, what is important for the community now? What are the questions the community has in order to be able to feel a greater sense of ownership and wanting to continue on with this initiative? So that is the overview of how we went through those 5 steps. Again, I would emphasize the importance of doing your homework, I think engaging all stakeholders in this process, knowing that because of the sensitivity of these things, you need to engage everyone, and that you're dealing with both politics, as Hallie said, where if you're going to be trying to practice inclusion and equality, you have to do it in the evaluation process as well. So thank you for this opportunity, and I'll pass it back to Hallie.
Great. Thank you, David. Thank you, everyone, Robin and Dennis and David, for sharing your interesting and really insightful experience with us today. Participants, you've been very active, asking questions, a wide-ranging set of questions, and so thank you for providing those. As you might expect, we have less than 10 minutes left, and we've picked out some of the questions we think are answerable in the time frame that we have. And so the first question we're going to pose to Robin. And Robin, the question goes like this. What about closing the loop with stakeholders? In other words, after all stakeholder input has been collected and decisions have been made about which evaluation questions to prioritize, how important is it to inform stakeholders about the evaluation questions that have been decided upon? For that matter, how transparent does the final process of question selection need to be? Robin?
I'm happy to answer that. From my point of view, transparency is key, because if you engage in this process without that kind of transparency, you undermine the credibility that involving stakeholders in the first place strives to achieve. In my particular case, I closed the loop in a very public and open way. After I met with the young men, 3 of the young men and I went back to the Michigan HIV/AIDS Council meeting, which usually has 100 to 150 people in attendance. And we presented to them the list of questions that were prioritized by the adults and the competing list that the young men would like to see as the priority. And then we talked about some of the possible ways that we could negotiate reconciling these 2 discrepant lists of priorities and what our thinking was as a group about how to deal with that. In the end, very few of the topics actually fell off the table. It was really a matter of emphasis. But throughout the entire process, we routinely went back to this body. The fact that we were coming was on an agenda that was announced well in advance, so other community members could come if they chose. And we routinely talked through with the group what we were doing. So it was a very important part of our process, and maintaining that transparency, I think, was essential to the entire way in which we were engaging the approach that we chose to follow.
Great. Thank you, Robin, very much. The next question, we're going to ask Laura Levitin from Robert Wood Johnson. Laura, the question is, how are these strategies modified when working with non-English speaking populations? What are your thoughts on that?
Well, this is really apropos of a lot of work because when you have a non-English speaking population, you have three challenges. There is the power differential that Robin alluded to, and you can imagine for Robert Wood Johnson as a funder, there's a tremendous power differential that's implicit in what we do, so we really have to be diligent about that. Then there's the language barrier and culture. So for both culture and language, it's worth asking, how do stakeholders want to be approached for their input? Clearly, we can have translators, but that still puts people at a disadvantage because they cannot necessarily express themselves, especially in a meeting with a mixed group. So one strategy I have seen used, we used it in a project on the Texas border with community organizers, was to conduct all meetings in both English and Spanish, which leveled the playing field because people could they could express themselves. There's certainly other ways. There's a million ways to skin this cat. It needs humility, and it needs a thoughtful approach to this. But I wanted to mention one strategy that addresses a related question, which was about the Delphi technique, and mention that Amelie Ramirez and her colleagues who direct the Salute America program for the foundation did a Delphi process with what is now a 1,500 person strong network of Latino community leaders and researchers about what should be studied. And their Delphi process is described in Health Education and Behavior this year, volume 38, number 3, page 251. And I'm sure in the follow-up notes for this we can get that reference to you. But the Delphi process is a practical approach to collect opinions and achieve consensus. It was developed by the Rand Corporation in the 1950s. And what we discovered with this is that it was a very efficient way of posing questions to a panel of folks with increasing focus over time. It offers convenience, anonymity, a controlled feedback process. I realize that's probably inadequate both to talk about language barriers and to talk about Delphi, but there's lots of ways to do this, and I highly recommend this article to you because I've never seen anything like it.
Great. Thank you, Laura, for also talking about the Delphi, because, yes, a couple of people did have a question about that. We have probably time for one more question. And, David, I'm going to ask you to answer this question. So here it goes. What advice do you have for helping to sort through all of the stakeholder input on evaluation questions and prioritizing which evaluation questions to address, given that stakeholder perspectives and priorities are bound to differ? David?
Yes. Great, thank you. And a challenging question, but I'll make it quick. I think one of the things that you need to decide, I find in my work that I decide to do is upfront, is determining my role in terms of being able to be the guardian of the process and making sure all voices are heard. What that takes is working with the funder or who's taking the leadership on the evaluation. I'm really determining from day one what level of input from the different stakeholders are important, and we put that in writing. That's part of the plan. That and develop an explicit plan with the funder on how to make sure all voices are heard, and when it comes down to decision making, how are we going to make those decisions because of the nature of the question. Some voices are going to be heard, people aren't going to be able to talk, which is why getting a lot of that information individual interviews allows us to push those points and raise those questions without putting people on the spot. We also have to leave time in those sessions to make sure that the different voices are heard, especially when it comes to more disenfranchised groups. And one of the things that even then, that at least puts on the table very clearly that we have to make sure that all voices are heard, and that becomes one of the ground rules for the logic modeling and questioning process. It then goes down to the question of how do you deal with all the questions that everyone's going to have with their different perspectives, which even makes it larger. And I think that we use a variation often of that technique. It's a nominal group technique, sometimes called N/3. We give people literally ask them if they're, whose issues are who, and begin to have them literally rate the ones that are important. But by voting for them, we're voting for 3 out of the list, and then taking the top numbers to it. But then again, going back and making sure with those groups that are have less strong voices and are not as powerful, that their issues are heard as well. And finally, what we do is that we make sure that there's feedback provided to everyone, after it about what the final questions were, because people want to see that, and that we often send it out in another larger project to the other stakeholders that weren't there, the other grantee leadership that wasn't there, so that they could have a chance to also have input on those questions. And again, it goes down to a prioritization and a commitment to make sure upfront and explicit that all voices will have, and at least will have their priority questions as part of that.
Great. Thank you, David. So this brings us to the close of our webinar. I wish we could have addressed more of your questions because there were some excellent ones in there. But I would like to extend a big thank you to our panelists for taking the time to join us today, and to all of you out there for your interest and support of high-quality evaluation practice. I'd like to also extend a big thank you to my colleague and co-author, Natalie Jones, who has also helped design and implement this webinar. She's the one who's been helping with the questions and guiding us along the way, and Carrie Benjamin as well from FSG. In case you're interested, the webinar was recorded and will be available in about 2 hours with the same registration link, and it will be available for 1 year, as well as it will be on the FSG website with the slides and the recording probably tomorrow. Also, the Guide for Engaging Stakeholders in Developing Evaluation Questions, on which my presentation was based today, is freely available and downloadable at both the FSG and Robert Wood Johnson Foundation websites. In closing, we at FSG would greatly value your feedback about this webinar and encourage you to complete the survey that you will see when you exit the webinar. It will be a pop-up. Your responses will help us to continually refine and improve our offerings and work. So thank you again, and have a great rest of the day.